versus Triamcinolone acetonide.
Good noon. I will present improvement in macular thickness and DRIL after intravitreal bevacizumab versus triamcinolone acetonide. Diabetic retinopathy. Diabetes mellitus is a potential epidemic in India. Around 62 million individuals are currently diagnosed with diabetes mellitus, and it is also the leading cause of vision loss in adults aged 20 to 74 years. With the advent of the spectral domain OCT, we can have excellent cross-sectional visualization of retinal layers. Macular thickness, we took three measurements to measure the macular thickness, that is CST, CAT and CV, that is central subfoveal thickness, the cube average thickness and the cube volume. Disorganization of retinal inner layers, also known as DRIL, it is a novel non-invasive parameter, and it is also a predictive biomarker of visual acuity, as stated by Sun et al. The DRIL is defined as inability to distinguish between the inner four layers of the retina, that is GCL, ganglion cell layer, inner plexiform layer, inner nuclear layer, and the OPL, that is outer plexiform layer. We classified DRIL into two grades, that is in grade 0 the DRIL was absent, and in grade 1 the DRIL is present. Materials and methods. The sample size came out to be 88. So we enrolled 88 consenting patients of type 2 diabetes mellitus. They were randomly divided into two groups. The group A received intravitreal bevacizumab, IVB, and the group B received triamcinolone acetonide. This is the study flowchart. 88 consecutive patients of DME were enrolled, and it was randomized into two groups, that is group A and group B. Each patient was examined for BCVA, slit lamp biomicroscopy, and fundus examination, and baseline OCT was taken for records. After the first intervention of IVB and IVTMA, the OCT was repeated again after 1 month. The same method was repeated after the second intervention and even after the third intervention. We collected the OCT and the data was analyzed. Inclusion criteria comprised of the consenting patients and the consecutive cases of type 2 diabetes mellitus. The age group we took 40 to 65 years, and in case of bilateral involvement, the eye with the more severe disease was taken. Exclusion criteria: the patients who did not consent and who received previous ophthalmic interventions like intravitreal injections or intravitreal lasers, or the patients having systemic disease like CKD. The table 1, it shows the demographic characteristic of the two groups. The p-value is not significant. That means the both values are comparable. This table 2 shows the comparison of logmar visual acuity. As we can see, at the baseline, the p-value wasn't significant, but after the third dose, the p-value became highly significant. Even after the first and the second dose, we can see that group A, which received intravitreal bevacizumab, showed decrease in logmar visual acuity as compared to the group B, which received triamcinolone. The similar trends was observed in the CST. That is, at the baseline, the p-value is not significant. That means it was comparable, but after first dose, after second dose onwards, it became comparable. It became significant. That is, group A showed lesser decrease in the CST, which means macular thickness has decreased in group A, which received bevacizumab. The similar trends was noticed in the CAT. After second dose, the group A, the mean value is 297 and group B is 319, which further decreased in the third dose. The cube volume also showed the similar trends. And coming on to the DRIL grade comparison, initially all 88 patients had disorganization of retinal inner layers. But after third dose in group A, which received intravitreal bevacizumab, the DRIL became absent in 38 patients, which is approximately 87%, while the DRIL was still present in 6 patients, which is approximately 13%. In group B, which received triamcinolone acetonide, the DRIL decreased. After the third dose, the DRIL was absent in only 16 patients, which is 36.4%, and it is present in 64% of the patient. Comparing the two groups, we found that the data is statistically significant with p-value of less than 0.001. These pictures shows the result after anti-VEGF therapy. Pre-treatment, there is disruption of DRIL and EZ, and the same patient showed restoration of DRIL and EZ. This picture shows the triamcinolone acetonide therapy result. Pre-treatment, we can see that after the third dose of triamcinolone, the macular thickness is decreased. Discussion, IVB group showed greater reduction of CST than IV TMA group, which implies that bevacizumab is more effective than triamcinolone in reduction of macular thickness and visual acuity improvement. The similar trend was seen in DRIL. In subsequent doses, the DRIL improved more in IVB group, which implies that bevacizumab is better than triamcinolone in DRIL restoration, which is associated with increase in visual acuity. Conclusion being the intravitreal administration of anti-VEGF is more effective in decreasing macular thickness parameters, restoration of DRIL, and improving logMAR visual acuity as compared to intravitreal steroid, that is triamcinolone. Thank you.
What is the glaucoma problem in IVTA group?
No, sir. Sir, eyes with any other pathology other than DME were excluded.
Post-injection, any rise of ratio in IVTA group?
Sir, we monitored the patient and we kept the patient on timobrim BD. We monitored the patient for 1 week. After that, some patients showed increase in pressure, but it came to normal after third or fourth day.
It's not just because of edema, okay? There's a lot of inflammatory factors involved.
Yes, sir.
Triamcinolone is better for those situations.
Sir, but in our study,
how do you explain this discrepancy logically?
Sir, probably because
triamcinolone should have been a better. See, the visual acuity logMAR part we can consider because some eyes would have progressed in their posterior subcapsular cataract and so on. But how do you explain this discrepancy?
sir, probably because we took half dose of triamcinolone. We gave only 2 milligram of triamcinolone instead of the 4 milligrams.
Still, the duration would have got affected, but not the effectiveness.
Sir, but in our study, we found that 87% of the patient had improvement in DRIL in bevacizumab group, which is only 36% in triamcinolone.
No, after listening to your paper, just tell me what is the take-home message and whether it tallies with whatever is established in literature.
Yes, sir. In literature, it is already mentioned that intravitreal